Hello, my name is Shelley Mann-Lev, and I am a prevention consultant with the Opioid Response Network. Today, we are going to be focusing on an exciting new project called Schools and COVID-19, Addressing Resilience and Substance Use. I want to start by telling you just briefly about the Opioid Response Network, a SAMHSA-funded project that works with communities to address the opioid crisis. We are at a time right now where we have many crises, right? The crises of racial injustice and systemic racism, the crises of the pandemic, and we still have the opioid crisis. The ORN provides local experienced consultants like myself with expertise in prevention, treatment, and recovery to help communities and organizations respond to the opioid crisis and all of the intersectional challenges that are faced by our youth and adults. They accept requests for education and training, and in each state they have a team of prevention, treatment, and recovery specialists. I have the privilege of serving as the prevention consultant for the state of New Mexico. If you have questions or would like to submit a technical assistance request or get training, you can visit the Opioid Response Network on the web, www.opioidresponsenetwork.org. You can also email or call them. And of course, the funding comes from SAMHSA, and the views expressed here are mine. So it is a really challenging time for our youth. Many of you have seen these headlines, right? Deaths of despair, coronavirus pandemic could push suicide, drug deaths as high as 150,000, one study says. Pandemic drives alcohol sales and raises concerns about substance use. Trying to parent my Black teens through protest and pandemic. And as you can see in these images, how are our youth doing now? What do you see? Boredom, isolation, services that they would normally get at school, they can't get at school anymore. Schools are doing everything they can to be helpful, but parents are trying to homeschool. It's deeply, deeply challenging times. So I want to spend a few minutes with you talking about the effects of school closures, social isolation, grief, economic stress, race-based trauma on the protective and risk factors for substance use. We don't have a lot of data about what's going on. We certainly do have stories, but we know all of these effects have an impact on substance use. And of course, we need to work together on strategies for our schools and communities to build youth resilience and hopefully mitigate those impacts, to prevent substance use, and for those youth who are using alcohol, tobacco, opioids, marijuana, other drugs, to help them address those issues. So this project, which I'm very, very excited to introduce, is to help schools and other youth-serving organizations help youth during this time. It includes an extensive list of resources for schools about what's going on with youth, including many of the high-risk, high-priority youth populations, LGBTQ youth, youth experiencing homelessness, youth who are at risk of child abuse or experiencing domestic violence. And those resources can be found on the Opioid Response Network website. There's a link and you can click on it. In addition, we have a fabulous guidance document for schools. It's a guidance brief for middle schools, particularly although the recommendations apply beyond. And it includes two really valuable resources. One is a parent caregiver check-in, a list of 9 prompts and questions. And also it includes a link to a Google Drive list of online summer activity resources. And finally, we want to introduce that we'll be having back to school conversations with an expert panel, 3 fabulous people who both work in the schools and work with many schools, and well as an after-school organization. And those will be scheduled for early August, and we hope that you'll join us for those. I feel very excited about the guidance document and the written resources, 20 actionable recommendations, and I'll briefly introduce you to them. So the objectives of the project, really to take a look at and help people understand the impact of all these losses, all these changes. We have experienced an earthquake or a series of earthquakes, and the impact on our youth is profound. So We want to make sure to educate everyone who works with youth on the potential impacts on protective and risk factors for substance use. Of course, the project wants to provide direct support to schools while working remotely or working in a hybrid environment when some kids are at school, some are at home, some are, going back and forth, that to really be as creative as we can to meet the needs of our students now and when students return to school. And finally, again, to offer the Opioid Response Network, the ORN, to offer the resources of that resource list, that brief document, the fabulous family check-in, parent check-in questions, activity list, as well as the consultants who can respond in a even more tailored way to provide training or to technical assistance requests. So, remote education, what can schools do? They can take a lot of steps to increase protective factors and resilience, even in a remote environment. They can also implement strategies that will reduce risk factors for substance use, mental illness, mental health problems, and school failure. And one of the things that's so helpful in the school world is many of those risk factors are the same across all of those arenas. Their primary goal is academics, but you can't address academics without addressing mental health and substance use. Schools can also integrate social emotional learning, both in all of their educational activities as an independent part of the content, and provide prevention education. We know schools are recommitting themselves to address equity in this time of heightened awareness of systemic racism. Equity cuts across every issue, and it certainly cuts across substance use risk. And finally, connection to school is a protective factor for all of the risks that our youth face. And so staying connected, expressing that they care, you're important, I see you, even if it's on Zoom, and linking our students and families to resources is a critical role that schools have during these critical times. So for many schools, substance use seems like, very low on what they need to be addressing. And while there are so many needs, I wanted to highlight for you that substance use, not only in itself is a significant concern, it impacts ability to learn, it impacts safety. Of course, it relates. Youth substance use often turns into substance use disorders and, that difficult challenge that youth and adults face of really struggling with addiction. We also have immediate risks associated with substance use. Many people aren't aware that 25 to 30% of deaths by suicide involve alcohol. Hugely significant concern right now as we think about many of our young people being depressed and potentially being at risk of suicide. And alcohol is a major, major factor in many suicides. In addition, there's tremendous concern about domestic violence and child abuse, and where schools would normally observe, see, and be able to respond to potential risks or situations involving child abuse. Those eyes and ears are much harder to be there right now. And again, alcohol, we know, is involved in so many of the incidents that hurt our children and our families. And finally, there's the immediate risk of overdose and overdose deaths. The American Medical Association has reported across the board in so many areas, 15 to 20% increase in overdose deaths. There's a variety of causes of that, including fentanyl, which is being mixed into the supply of so many opioids. But that risk is real for our young people, for themselves, and real for our families. So hopefully, as schools heighten their awareness of suicide, child abuse risks, and the need to pay attention to that they also can understand that it's critical to pay attention to substance use. So for schools, can't do anything alone. School wellness teams hopefully will be inviting in community coalitions to work together with them to look at what can be done right now. What strategies, how can we together look at the needs, look at our capacity, and plan and implement some hopefully not too demanding but important interventions that will help reduce the risk factors and protect our kids from substance use. Key players in this are school staff like school counselors, but also clinicians, administrators, teachers. All school staff have a role to play. And finally, both our audience, the students and their parents and caregivers, but also they have a role to play in planning and problem solving. We want to hear their ideas and respond to what they suggest. And our community partners who can provide those critical resources, whether it's volunteers or people to help, services that are so desperately needed at this time. So we need everybody engaged. A couple of caveats to remember. One is schools need to follow, all school staff and community partners need to respect that there are district and school protocols, especially for how school staff connect with students and families during those times. Those protocols vary and everybody needs to tune into their own. In addition, this is a time when self-care is essential. Being kind to yourself, you know, as they say on the airplane, putting on your own oxygen mask first, and really breathing. Breathing is the core mindfulness and exercise, and we're actually going to pause for a moment to take a breath, because as we get bombarded by information and things to do, connecting with ourselves is so important. Calming our nervous systems, regulating ourselves, just like it's important for our kids. So I'm going to take one deep breath with you. Hopefully you're familiar with belly breathing. You can put your hands on your stomach and breathe in through your nose, feeling your stomach expand, and breathe out through your mouth. We're going to do that again. Through your mouth. It's part of being trauma responsive and using trauma responsive educational practices. I know during this time I have really upped my awareness of that need to take care of myself so that I can serve. And I hope you do that too. So I just want to give you a taste of some of the guidance that's available to you and things you might think about. A lot more details in that 4-page middle school guidance for schools on addressing resilience and substance use. So there's a section on supports for families, ideas like, of course, doing parent check-ins and asking about home safety. It's really critical that we include questions about what's present in the home. Alcohol, opioids, marijuana, tobacco, guns, that all of those need to be safely stored away. Suggestions for how you can do warm handouts and how you can communicate and share resources in many different ways. That parent check-in, I have to say, is a very exciting part of this project. It's available in English and Spanish. It includes a list, like I said, it's a 1-page list, and anyone who's doing parent check-ins can follow prompts, questions that help them engage with parents in a caring and compassionate way. Are you safe? Who are the supports in your life? How are you connected with them? Basic needs, your family's well-being, any changes in terms of substance use that might need attention, and of course, that home safety and summer plans. In addition, supports for students, ideas like having a virtual calming room and links to that, getting student voice to participate in the education process, lots of different ways to connect, and making sure that you prioritize students who are at highest risk. And supports for staff and teachers, creating a culture of care, this wonderful example of a Teacher Appreciation Day. Again, many, many ideas and ways to connect with school leadership, and including encouraging training in warning signs and referral. So I hope you find yourself interested in learning more about this project, checking out these resources that are available at the opioidresponsenetwork.org website. and that you'll join us for our back to school conversations. I think you'll find them incredibly valuable and helpful to you. So thank you so much for your attention. Again, my name is Shelley Mann-Lev, and I really appreciate you learning about how you can help our youth, help our schools serve our youth even better. Thank you.